Who is most at risk for cerebral infarction? Cerebral infarction, often referred to as ischemic stroke, happens when blood flow to a part of the brain is blocked. This blockage can lead to serious tissue damage. Understanding who is most at risk for this condition is crucial for prevention. Several factors play a role, and they can be divided into modifiable and non-modifiable categories. One of the most significant modifiable risk factors is hypertension, or high blood pressure. This condition can damage blood vessels and increase the likelihood of clots forming, which can block arteries in the brain. Heart disease is another major risk factor. Conditions like atrial fibrillation, which is an irregular heartbeat, can lead to blood clots that may travel to the brain. Diabetes mellitus also raises the risk of cerebral infarction. It can damage blood vessels and promote atherosclerosis, which is the buildup of fats and cholesterol in arteries. Obesity is closely linked to diabetes and hypertension, further compounding the risk of stroke. Smoking, whether active or through secondhand exposure, is harmful as it damages blood vessels and increases the tendency for clotting. High cholesterol levels, particularly low-density lipoprotein cholesterol, contribute to narrowing arteries, which increases the risk of infarction. A sedentary lifestyle is another factor that can lead to obesity and related health issues, increasing the risk of stroke. Additionally, excessive alcohol consumption can raise blood pressure and contribute to stroke risk. Age is a non-modifiable risk factor, with the risk increasing significantly after age 55. Race and ethnicity also play a role, as African American and Hispanic populations tend to have higher stroke risks due to higher rates of hypertension and diabetes. Gender differences exist as well, with men generally having a higher risk of stroke than women, although women often experience strokes at an older age and may have higher mortality rates. Other medical conditions, such as obstructive sleep apnea and sickle cell disease, can also increase the risk. A family history of stroke or a personal history of transient ischemic attack, which is often called a mini-stroke, can elevate risk levels. Hormonal factors, such as the use of estrogen-containing birth control pills or hormone replacement therapy, may also contribute to stroke risk in some women. In summary, individuals most at risk for cerebral infarction include those with high blood pressure, heart disease, diabetes, obesity, smoking habits, high cholesterol, and sedentary lifestyles. This risk is particularly pronounced in older adults, those of African American or Hispanic descent, and individuals with a family or personal history of stroke. Managing these risk factors through lifestyle changes and medical treatment is essential for preventing strokes. Always consult with healthcare professionals for personalized advice and strategies.